Welcome to the inaugural episode of Dr. Yang's ACEs Medicine podcast, a platform dedicated to exploring integrative and advanced approaches to health, wellness, and medicine. I'm Dr. J.D. Yang, and today we delve into a subject impacting millions globally, autism spectrum disorder, or ASD. Autism is a complex and multifaceted condition. While treatment options are frequently discussed, it is crucial to ask what is autism and why are its rates increasing. This episode serves as the foundation for a series where we all dissect the various dimensions of autism, from genetics and biochemistry to energetic medicine and spiritual perspective. Today, we'll explore, number one, the history of autism and its initial identification. Second, the rising prevalence of autism in the United States. Debates surrounding its causes, genetic, epigenetic, environmental, and more. The ACEs medicine perspective on autism through multiple dimensions: anatomy, biochemistry, energy, and spirituality. I encourage you to approach this discussion with an open mind, as autism is a complex and evolving topic. Let's begin. The prevalence of autism has risen significantly over recent decades. According to CDC, in the 1980s, autism affected approximately 1 in 10,000 children. By 2000, this rate increased to 1 in 150. As of 2020, about 1 in 36 children will be diagnosed with ASD. This substantial rise prompts the question, are we merely improving in diagnosis, or is there an actual increase in cases? While genetic plays a role, the environment has undergone dramatic changes in the last 50 years, including factors like food, exposure to toxins, stress levels, and medical interventions. Before we get into the details, let's review briefly history. Autism was first described in 1943 by Dr. Neil Kenner, who observed children exhibiting extreme aloneness and insistence on sameness. Around the same time, Dr. Hans Asperg in Austria documented similar behavior in children, referring to the condition as autistic psychopathy. Over time, the medical community merged Asperger's syndrome with autism under the broader autism spectrum disorder diagnosis, or ASD. This decision has sparked discussions. Does this condition oversimplify the wide range of conditions within the spectrum? What is the real cause of autism then? There is no single known cause of autism, but various hypotheses exist. Genetic factors. Studies indicate that genetic factors play a significant role in autism, with heritability estimates around 80%. Epigenetic and environmental triggers. Even if genes play a role, what turns them on or off? Factors like toxins, stress, and diet may contribute. The vaccine debate, controversial, but worth mentioning. While no conclusive evidence links vaccines to autism, concerns about immune responses and adjuvants such as aluminum, mercuries, persist in some communities. Viral infections and immune dysfunctions. Some research suggests viral infections during pregnancy may increase autism risk. Gut-brain connections. Many children with autism have gut inflammation, microbiome imbalance, and leaky gut issues. Oxidative stress and mitochondrial dysfunction. Studies show children with autism have high oxidative stress levels and mitochondrial dysfunction. Is autism a single disorder or a collection of different conditions that present similarity. So, what is ACE's medicine approach to understand autism through multiple dimensions? Let's explore autism through the ACE's medicine model, examining multiple dimensions. Anatomic differences. Brain imaging studies show differences in connectivity and development in autistic children. Biochemical imbalance. Many children have methylation defects, high copper levels, B6 and zinc deficiencies. Energetic factors, of course, acupuncture and neurobiofeedback show promising response in regulating brain waves and activities. As far as the spiritual emotional aspects, some theories suggest that parents' health, emotional well-being, and belief system, and even past trauma can influence neurodevelopment. Understanding these dimensions can lead to more personalized and effective interventions. I would like to share some of my personal experiences and observation. In my practice, I have observed certain patterns. For example, genetic factors. In communities with high rates of intra-community marriage, autism is significantly more common, indicating a genetic component. Biochemical imbalance. Conditions like pyrrole disorders, where individuals produce excessive amount of cryptopyrrole, leading to the deficiency in vitamin B6 and zinc, are prevalent in this population. Balancing copper overload and methylation imbalance often improves mood and interactions, even though speech improvement may be limited. The interventions such as acupuncture, neurobiofeedback, and transcranial magnetic stimulation have shown promise. For instance, neurobiofeedback aims to train individuals to regulate their own brain activities, potentially improving attention and reducing anxiety. Similarly, acupuncture has been explored for its potential to alleviate certain behavioral symptoms by targeting specific energy pathways in the body. While these observations are anecdotal, they highlight the potential of integrating energetic therapies into comprehensive treatment plan for autism. Today's discussion serves as a foundation for our upcoming series on autism. In future episodes, we'll delve deeper into each dimension of the ACEs medicine model, featuring interviews with experts who specialize in anatomic and neurological research, exploring the latest findings in brain structure and function related to the autism, in biochemical and nutritional interventions, discussing the role of diet, supplements, and metabolic therapies. At the energetic level, we're going to examining the efficacy of practices like acupuncture, neurobiofeedback, TMS, and other modalities. At the spiritual and emotional support level, we want to understand the impact of mindfulness meditation and family dynamics. We aim to provide a holistic view of autism, offering insights and practical advice for practitioners, caregivers, and individuals alike. Thank you for joining me on this inaugural episode of Dr. Yang ACEs Medicine podcast. I hope our exploration of autism history, rising prevalence, and potential causes, and the multifaceted ACEs medicine approaches have provided valuable insights. Remember, autism is a spectrum, and each individual's experience is unique. By embracing a comprehensive perspective, we can move forward more personalized and effective interventions. If you have questions, comments, or topics you would like us to cover in future episodes, please reach out through our website or social media channels. Together, let's continue the conversation, work towards a deeper understanding and better support for those affected by autism. Until next time, stay curious and compassionate.